Need to.
Okay. For folks online, we had some tech issues that prevent us from being able to show you our view of everybody in the room. But hopefully the audio is coming through well enough for you guys to hear. If there are audio issues, please let us know. And with that, I will turn it over to our chair for welcome.
Hi, everyone. Welcome. This is Rachel Stucker here.
Confirm they can hear us.
Lillian, can you confirm that you can hear us? I don't think they can. Oh, she can hear us, even though it says
Yes, we
join.
can hear you clearly.
Good.
So interesting. Wonderful. Thank you, Lillian. Good afternoon, everyone. Excited to be here with you. We're going to start. You should all have gotten and seen the agenda. The first item on our agenda is welcome and roll call attendance. So I will say to everyone, welcome. Lovely to see you all. Caitlin, can you do the roll call attendance?
Yes. All right. So Rachel Stucker,
Here.
Lillian Harrison,
Here.
Sheila Grant,
Here.
okay. Ed Gutzeit, Ed, it looks like you're muted.
Here.
Okay, great. Thank you. Portia Harvey,
Here.
Nick Beard,
Here.
Karen Records, absent. Patrice Gibbs, absent, and Sarah Ryan. Okay, Madam Chair, we do have a quorum.
Wonderful. Thank you, Caitlin. All right, so on to number 2 on our agenda, subcommittee business. We would accept a motion to approve the November 14th meeting minutes.
I approve.
Okay,
So
so
was that Portia?
okay, so Portia motioned
I second.
Second.
yeah,
Okay.
and Lillian second. Okay, real quick, I'll just go down the list of folks so we can give our votes. So Rachel,
In favor.
Sarah,
In favor.
Nick,
In favor.
Lillian,
In favor.
Portia,
In favor.
Sheila,
In favor.
and Ed.
In favor.
Okay, great. The minutes pass unanimously with all members present voting yes.
Awesome. Thanks, everyone. All right, so the second part of number 2 on our agenda is task force and subcommittee updates. Caitlin, would you be kind enough to give the full task force update just to make sure everyone's aware? Because I know not everyone always
Yes.
reads every line in their email.
Correct, yes. So a number of the subcommittees and subcommittee members have expressed a desire to have extra time to come up with recommendations to share with the full task force. And so our co-chairs have decided to seek an extension to our reporting deadline. And I just realized I forgot to acknowledge that one of our co-chairs, Senator Huxtable, is here with us on this call. So thank you for joining. So basically, the enabling legislation for the task force requires us to report out by March 1st. The House is drafting a bill that would extend that reporting deadline to April 7th, 2025. So that buys us another 5 weeks. Now, this bill will still have to be introduced and worked through both chambers in January when session resumes, but assuming it passes, that allows us a little bit more time to work as a subcommittee. Specifically, that would allow each subcommittee to have a 4th round of meetings in the month of January. And if you recall, this is round 3 today.
Perfect. Thank you, Caitlin.
You're welcome.
So our proposal, so in terms of what we intend to accomplish today, and then hopefully with the extension, what we would hope to accomplish with another meeting in January, is today the goal is to continue what we started last month, going through the recommendations that were made by subcommittee members, discuss them, determine if folks think they're good recommendations, not good recommendations, and just see where the committee writ large stands on each of those items. If we are able to and have time, the next really important conversation about those recommendations is prioritizing them. We recognize that it doesn't make sense to send, 15 recommendations to the full task force. And so what we will want to do after those discussions, whether it's at this, we'll see how far we can get in this meeting, but maybe it's our meeting in January, talk about prioritizing which we think will have the best, most important impact for the populations that our committee represents, and which ones we want to send on to the task force. So that's in terms of like what we're thinking about timeline and strategy. That's what Caitlin and I discussed and what we think makes sense. Does anyone have any questions about that before we start having discussion?
Okay,
Makes sense to folks?
all right.
I
think it's a good way to organize discussion.
All right, so I'm going to screen share from our Google Doc. Folks that are here in the room with me have printed copies, but it's exactly the same information as what is going up on the screen. Everybody who is virtual, you should be able to adjust, zoom in, zoom out as needed. Okay.
Perfect, thank you. All right, so after our last meeting, everyone was given an additional, I think, week and a half to go into the Google Doc and put any additional recommendations in there that they felt like were missing. After that deadline, what I did was I took it and I actually, just to make everyone more confused, I guess, reorganized it. With the goal of actually hopefully making it easier to follow and starting to put it into the form that I think it will need to be in to go to the full task force. So what you're looking at right now, the content should be pretty much the same. I didn't take anything out or add anything, I don't think. That was not the intent. The intent was to organize it. So one of the things that we are tasked with doing is coming up with either legislative recommendations, funding related recommendations, or regulatory related recommendations. And then also describing who should implement those things, who we think should implement those things. So I started going through and doing that for some of the things that we already discussed, and put a status on some of them. So for example, if you look at the first page, you'll see one of the things we talked about last time in barriers to accessing housing was preventing eviction filings from staying on your background check for more than 7 years. And there was committee support generally. So, and who would implement that? That would be a legislative fix, and some information there about why we think that's important. And so I went through and did that for a number of all the ones that we talked about, including trying to include some of what we discussed at our last meeting and some of the, why is this important? Who should implement? So what I'd like to do is go ahead and move to ones that were not discussed and have discussions on those, as the primary part of what we do today. Can I tell you where that first one is?
Yes, please.
So the first one is under regulatory and it's number 4.
All right,
That one.
here we go.
Yep. Okay. Yeah. Okay. So this is the first one, and all the ones that weren't discussed are from here and down. That was added to the document that this committee hasn't discussed yet. So we're going to do the same thing we did last time. Whoever put it in there, I'll ask them to share their thoughts, explain it a little bit, and we'll all discuss. So Sarah, I hand it to you.
Oh, super. So my thought process here was that we have a large number of individuals in our state who need supportive services in order to maintain housing. Those supportive services vary by population and certainly by need. But one of the issues I think that we have across the board is that we don't have enough people trained and able to provide the services necessary. And so working with the different state agencies to ensure that there is a workforce able to meet the needs of individuals, I think would be a cross collaboration between a number of different agencies. But specifically to highlight the Department of Education, I think this is a huge opportunity for both, you know, college and career readiness and certificate learning and adult learning, adult like re-education. So I think, again, it's probably across multiple agencies, but just to point out that like there are specific opportunities to partner with, for example, the Department of Education.
Great, thank you. I wanted to ask a question. So you say specifically about engaging the private sector in the provision of support services. Can you talk a little bit about your, like, what you mean by private sector and like, can you just talk a little bit more about that?
Yeah, so a lot of the services that I see provided are through nonprofit or state supported agencies. And there are programs across the country that have utilized private sector agencies or private sector support to increase this workforce. So I don't have a specific example in mind. I did look it up when but I think, you know, what I'm talking about is like kind of cross collaboration with everyone, including employers in the state that may not be part of the state systems.
I would be really curious to see the examples you have, because I think we want to be like, I don't think Sarah came in and be like, we should privatize everything.
No.
So I think having a specific example of where you're drawing it from, I would find really helpful.
Yeah.
You'd be able to
I
say
think
that.
it was specifically around like the training, right? So engaging private sector folks in kind of developing this workforce and providing the workforce was where I was going.
Okay.
But I don't mean privatize all services.
So I think that's
I
what.
would be surprised if that was your proposal.
And okay, because I think I remember I had asked you this when you first sent it in, related to, and I think you had mentioned MCOs.
Mhm.
Is that part like, again, I don't know if are they private?
Yeah.
Okay. Quasi, like again, so I think this is
Yeah.
why.
Yeah.
Okay,
So
okay.
I mean, yes.
So maybe
I
the
don't
way,
know if we need the word private. I think I'm talking about, and people can make it better. I think I'm talking about like utilizing all of the systems to provide support and helping communicate with those systems around needs and training and development.
so maybe it's Delaware should engage like across multiple sectors
Sure.
to develop an appropriate workforce to provide services to, like, in some, you know,
Yeah.
cross-sector collaboration in order to.
Should partnership be a
workforce
part of
development.
that? Because I feel like what you're talking about is more partnerships, right? Including private sectors in partnerships. And that makes it sound a little differently. Like not like you're trying to privatize, but that you're simply trying to partner.
Does adding partner right there in the sentence get at what you're describing, Lillian? Delaware should engage and partner across multiple sectors in the provision of supportive services.
I feel like it does, because it doesn't allude at all to the privatization or something like that, which I do understand. But it looks at us exploring partnerships to increase the capacity to provide these services.
Yeah, and so maybe it's something like the development of a well-trained and sufficiently something workforce, right? A good work, like
Yeah.
a bigger, better workforce, just use the words bigger and better. I don't know, it's easy.
Thank you for making it better, Lillian. Rachel.
All right, Margaret Thatcher.
Wait, who's Margaret Thatcher? Okay.
Margaret Thatcher.
I just know it's not working.
Yeah, and I think this is the only recommend that I think is actually focused on workforce, if I'm remembering correctly. So I do think acknowledging that it's not just about supply, but also about workforce who is going to provide that
development.
support
Mhm.
is an important thing for us to consider in it.
Mhm.
This is Caitlin, just because I know you all can't see us here. Should part of that conversation also be wages for those workers?
I mean, I think that's where you partner with the Department of Labor and the governor's office, and I don't, I don't know if we wanna include that in our recommendation. Certainly everyone on the committee can decide that, but.
I mean, but I do think that if we're talking about a stable workforce, that is part of what, yeah. Stable.
That's a good word.
Okay. Ed has his hand raised. You're still on mute.
Ed, do you mind unmuting yourself?
There we go.
I'm unmuted.
There you
Caitlin, I just sent you an email. If you could put that on the screen so everybody could see, and I'll quickly explain what it means. It's a very brief email.
I'm checking my email from my phone. I don't think I've gotten it yet.
Oh, well, then I'll hold off my comment till.
Let me, hang on. I gotta stop sharing my screen to check my email from my laptop.
Is it specific to this recommendation, Ed?
Yes,
Okay.
and it's a point that we have to keep in mind.
Yeah, it has not yet hit my inbox.
Geez. Okay, well, in that case, let me describe it to you, because it's been sent. It's from CNBC, April of this year. The salary a single person needs to live comfortably in every state. And according to CNBC, that is $94,141.
In Delaware?
In Delaware. I'm not sure how they did that, because it wasn't long ago, it was roughly half that. But that is what I haven't looked at this info in several months, and virtually every state that I can remember has doubled. And why I bring it up now is simply, as we're talking about trying to increase the workforce, we have to keep this in mind, that it will take a lot to bring the salaries of care workers close to what it should be. And the point is that will take time. And we have to educate the community about this. We have to educate the state. And we have to make plans for not being able to provide an adequate cadre of care workers. It's extremely shocking.
Thank you, Ed. So I think something, so yeah, yes, it would not be, I don't think increasing salaries or pay would necessarily bring someone up to that 94,000 mark, depending on their role in the care economy, for sure. And it wouldn't be something that would happen overnight, but maybe we do add something to, like, something about fair or livable compensation.
And
Because again, like, part of
Yeah.
what I don't understand about Delaware is, like, support service staff just throughout the different divisions and departments is, like, how they, like, define people as social workers or not as social workers and all the different levels. And it's a really complicated system of pay pay scale that I don't understand and don't want to or need to pretend to, but just generally maybe something in here about, like, looking at that clearly as an element of, like, workforce stability.
yes, and we recognize that caring professions, both the nonprofits and in the state, have a lot of turnover.
Mm-hmm.
And a lot of that is due to the salary, and we want people to be able to make their career in this, to be long-term, to have that expertise, to have that understanding of resources. A really quality case manager is the one who has a lot of experience in the area. So you're right, Ed, this isn't unique to housing for sure. But it is an elephant in the room that I think we can totally ignore.
That definitely impacts people's housing, right? If they're not getting the support services they need in all the ways I think we've talked about in some of the prior meetings, so. Does anyone have any concerns about this recommendation, feel differently about it? Do folks agree that that addressing the work, again, we're not having priority conversations right now, but that addressing the workforce needs for services for low-income people, vulnerable folks, people with disabilities, in order to access and maintain housing should potentially be an important part of what we recommend? Other comments, questions, concerns about it, things that are missing?
Just a procedural question, like, is this a fair note to add here? What I just put in, I don't know why it's highlighted. I don't want it to be highlighted, but
I do, that we are starting the conversation, if not finishing it. I also think this is the appropriate subcommittee that would be the one to talk about workers, because we are representing people who, it would be very lovely if you could say, here's a department, go forth. But we are also representing populations that really need that case management and that support. I think it is appropriate for us to be the ones who are bringing that need.
And it specifically says, review supportive services needed for the populations represented on the subcommittee.
Yeah.
Okay.
Would it? This is just a question which just hit me. I wasn't planning on bringing it up. There are national groups, groups that manage the process of people, not employees, people, volunteers, I should say, giving volunteer respite program help. There's in Phoenixville, PA, is the closest organized time bank where people volunteer to help others. In return, they owe time. They receive help in the quantity of the time they volunteer. I hope that's straight. But what I'm saying is, I think we need to think, at least in the short run, short to medium run, of how we will manage the caregiver problem. Because without doing something, it's conceivable, among other things, the numbers of homeless persons will increase. Plus other impacts, health and all that. So let's think about that. Maybe, I mean, it's up to the committee, obviously, but just wanted to put that out.
Specifically, the idea of time banking for volunteering.
And I'll send you there's Time Bank. If you look up Time Bank, Google, there's a group called Arch, and I don't recall what those are as respite, and I will send those links to you.
Okay, thank you.
do you want me to scroll down, Rachel?
Yeah, anything else on this before we move on to the next one? Okay, great. All right, so the next session, I went through and tried to figure out what was like a funding recommendation. So the next session is funding recommendations. These first two, so the first one I put Portia and Rachel, because we both had put things in the document related to increasing the stock of supportive housing, particularly for people experiencing homelessness. But then number two is an idea that I had put in related to how to increase like a specific, like a option for how to increase funding specifically for supportive housing. So I guess I'll just start by, so this next one is about Delaware should increase the stock of supportive housing for people with disabilities with the lowest incomes, targeting people experiencing homelessness who are the most vulnerable and living on the streets, who should implement DSHA, DHSS. And then the second one is an idea that I don't know how much traction it would get legislatively, but or whether it would need to be a law or I don't know, some of these might cross funding and regulatory and legislative. But this idea that like every year the federal government and like hopefully theoretically that would continue. I don't know. We'll find out. But the federal government has a National Housing Trust Fund that they allocate funds to each state for supportive housing. Delaware gets about three point something million a year for supportive housing. And so the idea is one of the things that I think the legislators and state folks like to do is match federal. It's a way for them to envision how they can contribute and match the federal resources, specifically to create supportive housing. So that was an idea that I had in terms of how to get more funds to create supportive housing. One of the reasons why there are a lot of reasons why supportive housing is hard to build and create. Number one, you need partnerships with, you need services because it's supportive housing. You need support services. So it has to be done in partnership with both the housing entities and the social service entities. It can't just be one or the other. And then the other part about it is that it requires a lot of additional funding to get the units to be subsidized to the point where they can be rented out to folks who are on SSI or SSDI income, who have the lowest incomes. And so those are the kind of two big pieces that I was trying to get at here was we need more supportive housing stock. We need more funding to make that happen. And it has to be through partnerships with DSHA and DHSS. It can't just be one or the other. And that's a critical component. So that's what 1 and 2 are really trying to get at here. Portia, again, I put your name under number 1 just because you had added some things around supportive housing. So I don't know if you think that what I have here represents your thoughts. So I shared mine. Portia, do you want to share some of your thoughts about this?
Sure. I think we were both making recommendations about the same target. One of the only things I would like to add is if we are looking to identify where the funding is coming from or how can it be implemented. I'm not aware of any carryover funds that DHSS might have. Unsure if they're able to tap into some of those funding sources to bring something like this into fruition. I'm also thinking about ERA funds that may be left over from the COVID era and if ERA funds can be used for something like this. And they would of course need to be used soon. But
yeah. I mean, I know, or at least I shouldn't say I know. It is my understanding that ERA funds very specifically have to be used for temporary rental assistance and wouldn't make sense or be appropriate to use in supportive housing or allowed to be used that way. But I mean, I'm not the ERA administrator. I could be wrong. I don't know, Caitlin, if you have insights into that.
I don't. I mean,
It'll also expire before any new supportive housing will come online.
Yeah, the ERA funding came to DSHA. That's what funded, of course, DHAP. DHAP is now closed. We do have HSP, which is the Housing Stability Program, which helps people who are facing imminent eviction with, paying for their rental arrears, security deposit assistance. But I don't know whether supportive services would be an eligible use of funds. And again, like you pointed out, Rachel, because those funds will expire at some point. I would think you would want to create a program that has a sustainable source of funding.
Yeah, a lot of service, like in a lot of other places and communities that have like a strong pipeline to supportive housing development, there are funds through DHSS that like the staff are gonna be providing support services to these clients, whether the clients are living on the street or in the housing. And there's a decision that's made strategically at the agency level that we'd rather
Yeah.
use these, like, we'd rather folks be housed, so we're gonna say like, okay, you create the supportive housing project, we're gonna dedicate this pot of our Division of Substance Abuse and Mental Health, SAMHSA federal pass-through money resources to supporting the people who live in this project. So there's like an intentional funding allocation to ensure that people in supportive housing have support services. I know that there's a lot of, or some, I should say. I don't know how much, I'm not the supportive housing people. But I know there's some partnership in terms of like group homes and recovery homes, but we don't have like a strong pipeline to supportive housing, which is different.
No.
Similar but different.
And I will say that like in
And-
theory, if you have domestic violence survivors should be and there's just no process to do it. So with supported housing, it almost. I think you make a really good point about what it can do, but I don't know if this sounds silly, but it almost feels like we're solving for a problem 2 problems down.
I don't know what I mean.
As in, we have a couple problems we have to solve before we get to this problem when it comes to supportive housing.
Like what?
It almost feels like prioritizing the fact that implementing, sorry, I know I'm talking a lot, that really walking the walk on the housing first model. Is the
Oh,
first thing
yeah.
That we need, to-
Yes.
if that makes any sense.
But you can't do that without housing.
It's true.
So like, to me, it's like both at the same, like 100%, but you can do housing first all you want. If you don't have housing, you can't do housing first.
Housing first. You kind of on the- Yeah,
So yes, 100%, like that's what I think we lacked a lot of understanding of like how to do that well. Like
yeah,
you can't just, we have some supportive housing in Delaware, we don't do it right.
right. And I don't think there's a lot of understanding of it.
Right, correct.
Per my recommendation, I would just ask maybe if we can pull that down. If it doesn't cover supportive housing, perhaps it does cover some type of housing production and it can be explored before that expiration date. I understand that we're working with long-term, but we also understand that the housing need is such a crisis that we need to do something before the long-term also.
So I guess I just want to understand, so sorry, you said pull that down, pull what down, sorry.
ERA funds to be used for housing production. We're talking about funds and
It can't be
identifying funds. So maybe that's not a sustainable source for the supportive housing piece, but it can still be leveraged for housing production.
So I don't think ERA funds can be used for housing production, but we'd have to find that answer from somebody. It's never been used that way. It's been used for rental assistance.
The ARPA funds were
Yeah.
used for housing production.
Right.
But I don't know that there are any ARPA allocations left.
No, and in fact, they're specifically trying to claw that back, so.
Yeah.
I mean, if it's helpful, this is Caitlin, everybody. I can get with Brian Rosello. He is our Director of Housing Finance, and all the ERA funds live under his shop now. I mean, I can ask him a little bit more about, our remaining funds and what they can be used for to get some clarity and communicate that either at the next meeting or via email before the next meeting. I'm happy to do that. Because I
That'll be
just
helpful.
don't know the answer right now.
Okay, that'll be helpful. Okay, and I know there's like some, there's, I don't know, between 10 and 15 million left, I think, or somewhere in there. And I think it's in the housing stability program, which kind of bleeds into or currently allocated that way, which bleeds into the next recommendation.
Mhm.
Oh, sorry.
Go ahead, Lillian.
Is this where we would put possibly, since we're talking about housing production of supportive housing, sorry, and it is inclusive of individuals with disabilities. Is this possibly where we can look at private partnerships or opportunity zones or incentivized areas where the creation of supportive housing might make sense? Like if it's in an opportunity zone, a DDD, these would be able to be funds that would be able to be tapped into to help match or to help increase supportive housing, or is that not where this possibility this would go, kind of, sort of.
Sorry, I'm not sure I understand the question. Are you still talking about ERA funds or are you talking about something different? I apologize.
Different funds. So
Okay.
so the creation of supportive housing, and the comments were like, we need more housing. And in that, in opportunity zones and incentivized zones, private private developers have additional money, because they get the incentives to build housing in those zones, in those opportunity zones, in those incentivized zones. So it would probably increase the likelihood they'd be willing to build supportive housing. And then when you're talking about individuals with disabilities, of course, you're talking about, not the supportive housing has to also include the adaptability to it, not just the accessibility of it, which only adds to the cost. And in those particular cases, again, with the incentives for private developers to do so in those zones, it might be matched money or additional funds, because there's quite a bit of money in the capital gains that are put into these opportunity zones. I know two such projects right now that have quite a bit of money in them from simply private developers, who could easily help to increase supportive housing stock, which of course could be supportive housing if there were additional incentives. Sorry, I know it was like a whole mouthful.
So, no, that makes sense. So finding ways to financially, well, to incentivize supportive housing development. When you say opportunity zones, are you talking about the federal opportunity zones or like the locally designated like areas of opportunity?
Well, I think probably both. I mean, we're talking about gaining funds. So I think both, if there are funding tied, obviously the federal ones, there's money tied to those, because if we build in those zones, we get a lot of incentives, including tax breaks. And so maybe it does cross over into that thing you were talking about earlier, like it kind of crosses over into legislation. Obviously it does. And maybe the increasing of opportunity zones, like if you're going through the state of Delaware, in Sussex County, we have less opportunity zones than if you go up north. So it probably will cross over into some legislative decisions, but increasing those would obviously incentivize the building of more units. And then maybe because of the needs that are discussed in this task force, it could also add additional incentives, maybe that would allow the private sector to engage with their capital gains funds to the level that we need to build more housing, and then also create that as supportive housing, maybe more points for supportive housing, more points for individual disabilities or something like that.
Okay. So the idea of incentivizing supportive housing development in certain like zones or areas that are already designated, but specifically supportive housing.
Yes.
Got it.
Does what I have highlighted in blue, does that capture it?
Yes.
Great.
Great, thank you.
Well,
okay. Are anything else on, I mean, I think the financing, the land use issues that come up with, like, I know one of the ways that supportive housing, one of the things that can be a major barrier to supportive housing development is obviously the inability to, or the zoning issues that come up if you're trying to like create like a project that has really small units or a high density project that would make it more affordable, therefore be able to meet the needs of people who would live in supportive housing. So like along with supportive housing development and creation, there come all kinds of like funding questions, all kinds of land use questions. Do folks want, but then there are also other committees talking about both of those things. So I think one of the way, like we have a land use specific
Regulatory,
subcommittee.
yeah,
Right.
regulatory and permitting subcommittee is looking at zoning and land use. And certainly we've talked a lot about zoning reforms.
Mhm.
Things like allowing, ADUs by right,
Mhm.
or what's sometimes referred to as missing middle housing types, so duplexes, triplexes, things that are in between your single family detached and your high-rise apartments. But personally, as the person who's staffing all these subcommittees, I find value in this subcommittee coming up with specific zoning recommendations to serve our populations, because I don't think the folks on the other subcommittees are as dialed into the specific needs. I mean, that's why this subcommittee exists.
Yep.
So I am throwing in, you know, my vote that doesn't count for recommendations about whether it's group homes, single room occupancy, developments. I think all of that would be meaningful coming from this subcommittee, if that is the will of the subcommittee. And Sheila, I know you have, you know, some insight into model ADU ordinances.
But even ADUs, like those aren't gonna, not that there's anything wrong with ADUs. I love ADUs. We could talk about it for a long time, but that's not gonna be like a stock of supportive housing, right? That's like in any like meaningful, large scale way.
Right.
To meet the immediate needs. So I think part of what I'm trying to think through, and I'm doing it out loud, so I apologize if it's not very clear, is how can, if all these other recommendations are gonna be coming out of these other committees, how do we create a recommendation, as you just said, that's specifically about the population of folks that need supportive housing, and how to get that as part of the incentives for other types of affordable housing, how to make sure it's included in when people are thinking about like changing land use and zoning regulations, that they're considering and ensuring that like SROs or micro units and efficiencies are allowed in those developments as well. So how do we like frame a recommendation that ensures those things get inserted? That makes sense.
You mentioned three
Yeah.
things: the ADUs, the missing middle housing, and what was the third one? The zoning changes, I guess. So as you say, there are a lot of those things are being considered in other committees, but I guess it seems like with most of the things that we're considering as recommendations, there could be something added in, like a preference for age-friendly housing, some sort of incentive or requirement for age-friendly units, for a certain percentage of them to be age-friendly. I've been looking a lot into Newcastle County just passed an ordinance last week allowing pocket neighborhoods. You know, the zoning would have to change to allow this increased density. I guess we want to recommend maybe that we're matching what's being built to what the need is. And there's a great need for 1 and 2 person households that don't need a big yard and maybe don't even need a driveway or a garage, that just, you know, I would just want to infuse into it somehow that my special interest with AARP is that we are meeting the needs of older residents. If they don't, many of them want to stay where they are in their same house, but many of them want to downsize into something more appropriate without steps, without a big yard. So I would just want to, I'm not sure where that fits best here, but maybe more than one place that we would take a look at the population. And I know the state has numbers of what the need is, what the number of people in households are, and try to give the incentives or the requirements to make sure that the building permits that we're approving are going to meet those needs. It's not
Yeah,
like you said, sorry.
Oh, no, go ahead.
I feel like you said a magic word in there, especially when you're talking about development and what's allowed and how we're crafting a recommendation that will help, and that's density, because that's the thing that we fight most in trying to increase the number of units in any development, is the ordinances around density right now. So I think that was a magic word in what you were saying. And if we're going to be crafting a recommendation around that, I think we somehow have to kind of whittle that part in, whether we're supporting one of the other committees or something that's probably honing in on density and zoning and ordinance laws. But certainly that's a huge barrier for us, is the density.
And this is Caitlin. Yeah, density has come up, I think, in every single one of the other 4 subcommittees. So it truly is a magic word. The other magic term in my mind is by right or permitted use, right? Like if something is a permitted use, then you can build it. You don't have to get a conditional use permit and have that public hearing, which we all know that's when, you know, things can go sideways for projects. Ed?
Sheila brought up an important point, which applies also for persons with disabilities, the type of housing, the accessibility in the housing. And a thought just came to my mind. So you could throw this out if you choose. Since we have a little more time, is there a way that we can engage UD and Del State, the economics department, the business department, to come up with what is the cost of not solving the problem? It isn't free. The state incurs costs when these problems aren't solved. And that might make an interesting addition to our report if it's possible that this info exists. Just a thought.
We're
I
just
said-
we're
yeah, sorry.
digesting.
Yeah. When I think it's about like sorry, my brain automatically goes into a lot of detail with what you just said, Ed. So I'm trying to zoom back out in my brain. Because like cost of solving what problem for who? It's just yeah. Sorry, I know.
I mean, that's
like
the rub.
I know. But I think yeah. I mean, I think one of the studies that was done a long time ago that isn't helpful here, but was like showing the economic value of the creation of an affordable housing unit, which isn't quite what you're talking about here. That's what brought to mind. It's old, it's not like usable in this economy. It's from like 2007. But yeah, what does it solve? What are the cost savings to the community when people are stably housed in supportive housing and having their needs met? Yeah. Okay. Anything else? So I'll just note one of the things farther down, it was number 6. Again, I didn't put a ton of detail in it, was just that again, like what we were just talking about, SROs, micro housing units, like a way to make those happen, right? It's funding, but it's also land use and it's
Right.
also all kinds of stuff. But it's specifically calling out that type of housing for the folks we're talking about, I think is important. So we don't have to talk about number 6 again. I think we just had a good discussion about it.
I think so. I think it's acknowledging that, yes, there's complicated barriers, but here are some of the ways we can reduce, though not eliminate them.
I mean, maybe we should just recommend that, you
Reduce
can
all
always build
barriers.
SROs anywhere by right. I'm just kidding. Okay, so should we move on to the rental assistance? Keith, are we good to move on from SROs and or supportive housing? Just generally? We've taken a lot of good notes and we'll kind of reorganize those before the next meeting around the issue of funding and incentives and zoning. Okay.
I want to say density equals diversity.
Ooh.
But because
Density
Okay.
equals diversity. Wait, what kind of diversity? Oh.
Yeah, I will feel better once we've organized these talks a little bit, because I feel like we have a little bit of various
And
stream
I,
of consciousness,
Mhm.
you can turn it into.
yes, and thankfully, Michelle Statham, my colleague, is on the call and she's taking minutes, so we have. We do. We love you, Michelle. We have my notes that I'm typing live, but Michelle will also have wonderful notes that we'll be able to use to reorganize our brainstorm. Okay, which number should I be on now?
So number 3, the one right after the Housing Trust Fund one. Yep. So Delaware should implement a statewide emergency rental assistance program for households in rental arrears. Sarah, this is you. One thing I will say, and I don't know if it was stated this exact same way, but this is something that the incoming governor did include in his housing policy platform as a candidate. This idea of ensuring that we have ongoing crisis help for households who have rental arrears. So that's my addition. Go ahead, Sarah.
Yeah, that's it.
That's it? Okay.
It's all in the.
But this idea that there would continue to be support for, especially, can I just keep on that on?
Sure.
Okay, especially in this housing market where people are, rents continue to go up, people continue to be priced out. And like the growth in rent has been dramatic. People are going to continue, people who are working full-time, 2 full-time jobs sometimes are going to continue to have problems meeting their rental obligations, having some type of fund that folks can continue to come to for that crisis help. I know like Portia, places like Catholic Charities have those types of funds. And some other places in the community regularly have them. I know that there are like, in a lot of communities, churches will, again, like one-off help people, neighbors in their community, people who are their congregant. But all that's really, I know at least my understanding is that a lot of those funds are available when they're available, run out when they run out. And there's no real reliable way for people to know that they're going to be able to get that, or know where to go to get that help. If anyone knows anything different, feel free to chime in. But the idea here is that there would be some type of reliable resource for folks who need that to prevent eviction.
Yeah, and I really do appreciate the thoughtfulness DSH and others have put into it, but there's the fact that one with DHAP now, it's Housing Stability Program. I think if you are not in the know, it can be very hard to figure out these programs as someone who is just a member of the community looking to use them and to find them accessible. And so I think you are right that having something steady, we know the parameters, it's understanding, the word can spread through case managers and social support workers would be really helpful.
And I think some states or jurisdictions that got ERA funds have created, and I don't know exactly what funds they've used or how they've done it, but have created their own, okay, this worked really well to keep people from being evicted and displaced, and they've created their own funds to continue the work.
Yeah, and when we say it worked really well, Delaware is an outlier right now. Like if you look at eviction lab data or other data across the country, like our evictions have not yet reached pre-pandemic levels. Like we are doing a good job right now, and the reason is of preventing evictions, and the reason is this crisis assistance. Evictions are about financial need. So
As an employee of DSHA, I feel like I have to at least share a little bit of context, which is that, to my knowledge, prior to the pandemic, we were never in the business of giving general rental assistance to people outside of our voucher and public housing programs. And the only other thing that I'll say on this call about it is if this recommendation does come from this subcommittee, if there is a recommendation that a program should be created and funded, obviously you would need to identify the funding source, and a certain amount would need to be set aside for administrative costs. DSHA is not like other state agencies. The majority of our operating budget does not come from the state or even the federal government. And so if we were tasked with a more permanent DHAP-like program, we would need to have resources to actually staff it and get it out the door. So just sharing that as an FYI, I am now going to take a step back.
Well, and I'll just say the other thing about this, and it doesn't, like I put DSHA there, that was just my brain, just because that's where ERA is at, but it doesn't have to, like, It could be, I don't know, it doesn't have to be, I don't know, again,
Or it
like.
could be the nonprofit.
It could be the nonprofit world, it could be that, and it could be that it's a fund that's specifically designated to operate through the eviction, whatever you call them. Thank you, the right to representation, where when someone's facing eviction and the issue is $500, that they can immediately access, right, that it's administered by the same person administrating that program, they can immediately access that $500 and just pay it and move on. So I think there's a lot of different ways to think about it. It doesn't have to be.
Yeah, we would have, I don't think we are the committee to make practicality recommendations,
Yep.
but I think there would be a lot of thinking, like. And I'll bring in my own expertise, running a nonprofit that just gives money for reproductive health care. Do you have a certain amount each month, and when it's tapped out, it's tapped out? How long is it
Right.
a string? So there's all kinds of things that you would have to figure out.
Yep.
But I think to circle back to the point that you brought up is. The point is the program needs to exist, and it needs to exist in a way that's accessible and clear and stable and, right, you know, certainly it could be a nonprofit, it could be the state service center, it could be
Right.
the SHA, but it can't be. Here's a list of 40
That
places
may or may
that
not.
may or may not help you. Please call all of
All
them.
of them.
And they all will have different requirements for how you can get
Yeah.
$200.
Okay,
Yeah. Anyway.
Yes.
so does this capture it, what you just said, Sarah? Program needs to exist in a way that is accessible, sustainable, predictable? Are those the words?
Yeah.
Okay, okay.
That's the key word there, Caitlin.
You know, I'm just trying to take good notes.
Other thoughts from other committee members on this piece?
The concept of a program being administered via a nonprofit isn't so odd. Right next door to us in Maryland, there is a for persons with intellectual and developmental disabilities, there is a .org, a nonprofit that helps people find housing. They must have some support from the state also. But the concept of a nonprofit is not so odd. There are numerous states that have that kind of concept.
So like our nonprofit helps when we can help. So I'm not sure who said that earlier, like what the process is when you're dealing with nonprofits, but it was spot on in that we help when we can. When we have the money, most of our money comes from either fee for services or programs that we do, and or CRA money as part of a program that we're operating. And so with that, we have precious little dollars sometimes to do families, depending on how we get our, what the funds are, and depending on the time of year that we can help, because obviously at some certain times of year, the need is obviously greater. And so if we can't catch them early enough, we're giving out bigger dollars just to help people stay in their houses, in which case we can't help as many people. But our funding generally, or speaking as just one nonprofit, I know there are many, but most of our funding comes from, our CRA monies that are through programs or fee for services or things like that we do. That's why it's not as sustainable, obviously, as we would want it to be, as this group would want it to be, because that's just how we're able to help, however we can help.
I just wanted to add a few things. I think even with some of the larger organizations, right, when we talk about predictable and sustainable, we want to believe it's sustainable, but the truth of the matter is a minor change in budget, scope of services, eligible activities can significantly cut the amount of resources that are going into the residences of Delaware citizens. Even further, I wanted to suggest that CMIS may help to coordinate this if we find that it has more functions where something like this could be better coordinated. I'm also thinking about Find Help and Unite Us platforms as coordinated entryways that the state is using widely, and also with community health workers being majorly funded and that being an initiative. I know this is we're just all doing work with the same people, just different things. So those are some ways that we could possibly come together, just some ideas and suggestions.
Great,
Thank you. Sheila?
I just want to ask like a really general question. Considering that the whole task force's title is Housing Production Task Force, we seem to be talking about things that are needed, funding and things that are needed for supportive housing. Is there anything that we would want to include in recommendations specifically about the production of housing, increasing? It seems like a decision has been made that we need more housing, and that's the lack of housing is what's driving up the prices and the rents. And I know a lot of the other subgroups, the subcommittees, are talking about zoning and talking about different incentives. But within our subcommittee, is there anything we would want to say to specifically address the supply of housing and the need for more housing, or maybe just what type of housing is needed? Maybe that's where our little slice of that pie is, that it's supportive, that it's accessible, that it's age friendly. But I just wanted to throw that out there in case people felt like we might be dancing around the main issue of the task force. Maybe I'm off
I
base.
appreciate your comment, Sheila. I just want to say, I think that what we're raising as concerns are good points, because we can produce housing all day, but the housing that we're producing is still unaffordable. So if we're not tackling some of the root causes that are coming with the housing being produced, we're going to continue to find ourselves in the same problem with those vulnerable populations being left out and things like that. So I think you raise a good point, but I don't think we should neglect any of the issues that we have been speaking on.
I agree with that. And I was thinking that as you were speaking, Sheila, that the overarching goal for this particular committee would be, since we are the a part of the affordable housing production, is the accessibility to what's produced. So I'm agreeing with that, because the issues I feel like we're talking about today are the accessibility to the housing that's being produced, or hopefully coming out of the other committees will tackle some of the challenges with literally building or producing the affordable housing. But once it's there, how do the demographic, and I feel like this group is more tapped in because we're from a grassroots perspective. We're from the perspective of the community of people who are not able to access what's already available even. And so how do we now make the in general accessibility, and then we're honing down on the groups and what their barriers are to accessing, being able to access the housing. So I'm agreeing, sorry.
A good follow-up to that may be, or may not, are there parts of the country that have rules that require a percentage of new buildings to be affordable or accessible? Do they?
Yes.
Okay.
There are projects throughout the country where I don't know specifically, but I can send it to you, where legislation for if builders or developers are accessing specific types of money, especially federal dollars, then they are required to make a portion of the development affordable. And I'm not going to say accessible, affordable. And they can do that. And we have a project. I mean, I think Shell Brothers, I'll have to send it. And I know Russ is on here and he may know more about it, but Shell Brothers had a project in Eastern Sussex that had a percentage of the properties for affordable housing. And it was a good number amount. I mean, so it can be done, it has been done, but the incentives for it based on the cost of developing still far, don't match the cost. Because I mean, the incentives for getting that money are great, but the cost for building a housing unit is still higher now than it probably has ever been. And so when you look at that and what you have to charge to even break even, we're still in a bind, a very precarious situation for building affordable units.
Lillian, do you think number 5 captures some or all of what we just said? What you just said?
Yeah, if you scroll down.
Yes.
I
Because
think the one piece that.
Yeah.
Oh, go ahead, Leland. I was just gonna say, I think the one piece in there that might be missing a little bit of what Lillian said is that you can require it, but if you don't have the appropriate funding or incentives in place, then it can actually
Correct.
slow development because people can't meet that requirement. So
Correct.
maybe there's an addition to this one that says something like along with appropriate financial incentives to ensure
Yes.
production doesn't slow or something like that, like, so that it's a pair, it's not just the requirement to
Oh,
include.
wait, I think we need to define the beginning of incentives, right? Incentive / subsidies for provision of housing.
Mhm.
So
Yeah.
what are the incentives
Right.
/ subsidies?
Yes.
Right,
Like,
got it, okay,
right,
yep, so requirement plus incentive and subsidy.
right.
Just for context, everybody, this is Caitlin. So LIHTC stands for Low Income Housing Tax Credit. It's a program that DSHA administers, funded by the IRS. It's in every state. It's actually the biggest driver of affordable rental housing nationwide. So my understanding is LIHTC projects have to have at least 5% of their units are accessible. But in Delaware, our QAP, which stands for Qualified Allocation Plan, those are the guidelines that developers have to abide by. Our QAP incentivizes having more than 5% units be accessible. So you can get extra points if you go above and beyond. So just wanted to share that in case folks weren't aware of that being a thing.
Yeah, but you used to incentivize development of
Mhm.
LIHTC with 811 units and you don't anymore. So we're seeing complete eradication of the 811 project-based units, which serve a really important purpose. That's why I put that in there.
Okay, yeah,
I would like.
I would
that's
want to,
like-
I think it would be helpful to run this specific recommendation by our Director of Housing Development, Stephanie Griffin, because I am not that far into the weeds with 811 to be able to speak on it.
Okay, we can reach out to Stephanie and get her thoughts, but the whole idea here is that there's a
But it-
requirement to do it and incentives and subsidies
But I
to do it.
don't think it's just DSHA, right? So
Uh-huh.
the requirement of new development to include a certain percentage of affordable housing. Lillian was actually kind of just discussing that. I think that's more of what local zoning incentives.
That you're more talking about inclusionary zoning. in that
More
part.
inclusionary zoning, but we don't have to use those words.
Right.
We love those.
Yes.
If I could just draw everyone's attention to our second Affordable Housing Production Task Committee meeting, there was a policy recommendations made. A policy that Massachusetts has adapted, Chapter 40B, allowing zoning boards of appeal to override local government's denial of affordable housing projects if less than 10% of the jurisdiction housing stock is affordable. That was a recommendation made very early on. Connecticut also has jurisdiction.
So I'm sorry to cut you off, Portia. You're absolutely right. Those weren't recommendations. Those were just best practices that we were sharing from other states to prime the conversation for the task force.
So are we able to make those recommendations for our state, I guess is what I'm trying to express. To look at some of those policy options that other states have enacted and adapt them for what works in our state.
So,
It seems
I mean,
kind of sums up an example of what was expressed.
so I think, so yes, this committee can recommend whatever we want to recommend. I do want us to make sure that I think it's two things. It goes back to what Sheila was saying, that we're addressing affordable housing production, but also which again, I find confusing because it's not the charge of this committee does not reference affordable housing production, but we know that that's the goal of the whole task force. So that, yes, because that is directly related to affordable housing production. But I think part of our role is maybe, I'd have to look at that again. Maybe we could look at that again as a group next time, at our next meeting, like that specific 40B, and what it does, but the idea of like, how do we make sure if we were recommending something like that, that we would have something specifically in there related to like the lowest income populations, for example? Does that make sense?
Yeah, I think I might have been getting to that. Projects must set aside 20 to 25% units for affordable pricing. Would that be capturing where you were going? Maybe not, I don't know. But
Maybe, yeah,
Connecticut
yeah.
also has legislation in place and now enacting affordable housing stock.
So just to clarify, are you, sorry, I'm trying to, again, just trying to organize all of this in my mind. So, okay, I'm gonna back up for a second. So back to where Lillian and Sarah were going around subsidies and incentives for affordable units in the development process, right? But then the second piece that I didn't realize was different is that part about inclusionary zoning or whatever we want to call it. The requirement that new development include a certain percentage of a certain number of affordable units. So that's, we're separating that out. That's more about land use issues. And then Portia, are you recommending specifically one of those things, or you just are bringing like Massachusetts or Connecticut, or you just want us to discuss them?
I wanted to provide examples. I believe the person that started this topic said they had some examples, so those were two that I could give you all clearly if anybody wanted more information.
And that's from the full task force meeting? Or was that?
Yes.
in
Yeah,
this
that-
committee and I'm not
I
remembering
think
it?
that was the second full
October.
task force. Yep, yep. I'm glad you read them. I'm glad we put this together and that they're being referenced.
Your work actually does.
Okay, where should I
What do
scroll?
other folks have thoughts about those recommendations in particular? Do you remember them? Like, so based on what Caitlin's written down, Portia, were both of those statewide laws? I think they were, right?
Yes,
Okay.
yep.
And the zoning board of appeals was in the Massachusetts one, and was that a board at the state level?
Yes, so I would have to stop sharing this
Yeah, okay,
document to
no worries.
bring up the slideshow from that to refresh my memory, but and there are a number of states that do similar things, so I don't want to like conflate two different states. But
Yeah.
my understanding is there are examples where if a developer that includes at least a certain amount of affordable housing units in their proposed project, if they get turned down by a municipality, they can then appeal to a state level board. And, you know, as long as the state level board says yes, they can go through with the project, even though the municipality is saying no. And I think that only happens in municipalities where less than 10% of the housing stock is subsidized in some way to be affordable to the lowest income folks. That's what I'm remembering without being able to read off of anything.
Okay, well, I want to make sure we have enough time to get through some of the other items that are on here so that our next meeting, we can organize based on some of this discussion and really focus in on prioritizing what we want to bring to the full task force, which is likely to meet again in February. All right, so we're going to move on to some of the things that we haven't had a chance to discuss yet at all. Portia, you had included a recommendation around a lottery system to make use of vacant and blighted properties. I'm not familiar with that at all. Can you talk about what that is?
These are just ideas. These are ideas and visions and what would you like to see or what do you think is going to help? So I know that in a lot of different states and even local governments, they have sold vacant, foreclosed properties for a low price. So that look like helping those units that are boarded up to now become livable and so add to the housing inventory. That's pretty much what I wanted to sum up there. It's been done
Okay.
several different ways. I believe if They are HUD approved housing. What's the homes for dollars? Does that sound familiar to anybody? HUD dollar
Yeah.
homes?
Yes, yes.
And then they've also done some auctions of vacant properties also. And it's just a way to help those houses get back on the market and become housing stock rather than just vacant eyesores to the community.
Portia, do you see this as part of an effort to also utilize a appropriate like land banking system to ensure that they be affordable or remain affordable? Or do you see this simply as getting vacant and blighted houses into kind of the market of the housing market?
I would say both. I would hope that individuals would have access to those homes. And when individuals don't have access to homes, when we have redevelopers that may be interested, that they would have an opportunity also. I think goes back into play on some of that legislation, right? If we have legislation enacting the housing to be affordable, then we don't have to worry about, hopefully, the majority of the people buying up the properties and putting them above market rate.
Yeah, I have concerns about, we're seeing more and more foreign investment, particularly in rental properties. And those are often blighted properties. So I would love to talk more about like, if we're thinking just about putting these properties back into the market for developers, how do we ensure that our communities are vibrant and affordable to the population?
I think that's a great point.
Focusing on.
I think that's a great point, Sarah.
So the word lottery system there, is that a specific way of doing this, or is that not really an important part of?
It's not an important part.
Okay, okay,
It's not.
okay,
No.
got it, okay. The next is the need for more senior housing. You know, I think a lot of what we've already
touched on that earlier.
Yep, that's what I was just thinking. Okay. Increased training and education around housing first. It got brought up earlier when we were talking about supportive housing creation, because if you don't do that, then supportive housing doesn't work the way it's supposed to. Do you want to add anything there, Portia? Like, how are you thinking about that?
Nothing to add. I think that goes more so on maintaining housing production and the housing supply that we have. So if we are trying to focus in more on production specifically, I would defer and not comment any further.
Okay, well, I mean, I don't think that this committee has to only focus on production. That's not our charge as a committee. So I just want to be like, we can and should also focus on production, but it's not our sole charge. Like our legislative charge is different. So just want to. Okay, the next one is respite housing for people who are experiencing medical challenges, not severe enough for hospital admission, right? Do you want to talk about that one a little bit?
Just more ideas. I know that that's a large area of homelessness that we see, individuals who have high needs and continue to go back to the hospital, even though their need is not warranted for admittance. So just looking for some type of support and housing for these people. It's just an idea. Again, most of these were just ideas that I wanted to bring to the group.
Okay.
I wonder if we could wrap that into our like and thinking about how to utilize MCOs and partner with them on these supportive programs and housing.
Yeah, a lot of folks in that experience have Medicaid and may have an MCO Medicaid worker. I know there are folks who are experiencing homelessness in homeless shelters and on the streets who have like Medicaid social workers that are helping them look for shelter or housing. Right. Okay. So, I mean, we just went through 4 quickly. Does anyone have any thoughts specifically for those?
I would say for the last one, I have a lot of practical thoughts. This is probably not the point to bring up.
Okay, for the rest of the housing?
Yeah, I mean, particularly when you think of MCOs and you're like, how does that apply to people who are undocumented? How does, we have this issue too with shelters where part of the problem is we get a little bit of a backup because there's nowhere to go, and I would worry that would be. Yeah, just some of the, like, I'm not opposed to the idea of it, I think we just have to have some thoughts about the practicality, so it isn't like. Parking people while you find affordable housing, oh, they've been there for years.
I mean, that, yeah. Okay. And then, Ed, you had recommended surveying what other states and localities are doing to require new construction is affordable and accessible for persons across a range of disabilities. Is that a specific recommendation that the state do some type of study or survey?
I think they need that, and I'm not sure the state will do it per se. Maybe the state can link with the two state universities or something like that. You know, UD has the Center for Disability Studies. Maybe they can provide help. But it would be interesting, in particular, this northeastern states down mid-Atlantic, see what's happening close to us.
Okay, great, thank you, Ed. All right, so those, unless someone identifies something that we missed, are all the things that members of this committee had asked, you know, had put down as a recommendation and wanted to hear the group's thoughts and discussion on. Based on the additional notes and discussion today, we'll work on having something prepared for our next meeting in January where we can go through and prioritize what actual recommendations we want to send. I might reach out to some of you if I want some of your help, like understanding some things or who to contact to get more information about certain items. But I think for the sake of time today, and obviously feel free to reach out to myself or Caitlin or anyone else in the committee between now and the next meeting. But I'd like to go ahead and ask folks to live schedule the next January subcommittee meeting. I find this is the easiest way that I have found to actually schedule meetings. So we wanted to go ahead and get a January meeting on the books.
I'm first going to share dates that are already taken by other subcommittees. I don't want to double book myself. So, just bringing up our legislative calendar real quick. All right, so we have the Finance Subcommittee is meeting on January 13th at 1 p.m. So hoping we don't pick the same date and time. Construction is meeting on January 16th at 10:30 a.m. And then Regulatory and Permitting is meeting on January 27th at 10 a.m. So all that is to say, let's try to pick a time other than those specific dates and times.
And does this one have to take place in a certain location or we just don't know yet? It doesn't have, like, we've done one in every county at this point.
Yeah, so what I'll say about that is it seems like every single time we pick a meeting room that isn't in Dover, either Legislative Hall or Hazlitt Armory, we have tech issues. Today is a great example. We're in a Del Dot building. We were told the tech would work. The tech didn't work. My preference is to try to hold these at Legislative Hall because the Senate hearing room tech always works. Always, always, always. That said, obviously, the legislature comes back in January. And so we would, if we wanted to schedule the in-person portion to be at Legislative Hall, we would need to do it in the morning or on a Monday or a Friday when they're not in session.
Okay. Well, I am wide open all day on January 21st. Would January 21st sometime in the morning in Dover work for other folks? I guess maybe the best way to do this is raise your hand or speak up if January 21st in the morning would not work for you. Lillian, that would not work for you?
No.
And Sheila, okay. Let's see. I could also do the morning of the 22nd. Wednesday, January 22nd. Raise your hand or speak up if that would not work for you in the morning in Dover or virtual. Portia, that would not work for you. Okay. I have very limited January availability.
And if the 21st works for everyone else other than me, I have an hour engagement in there from like 10 to 11 outside, and I can definitely adhere to that time. So, I mean, depending on the time, I might can do something. And do you just need it to be me? I know I want to be involved, but I can also get the notes and things like that if I'm the only one on the 21st.
Well, isn't Sheila, you're also not available then?
Yeah, my conflict is 12 to 1, so I probably wouldn't be able to I had to be back here at 12. So depending on the timing, or if I could call in, I could do something outside of that hour.
Well, it would still be virtual. Virtual would still be an option, right?
Yeah.
Okay, I was hoping it would be like easy, but it sounds like it's not going to be as fast and easy, which is fine. We can send out an availability. Because I don't have, the only other availability I have in January is like very limited. So, which I know is, yeah. So, okay, let's do this. We'll send out an availability poll.
Okay.
So that we can pick the time that most people are available and hopefully everyone is available. And we'll nail that down outside of this meeting. Okay.
All right.
We are now going to move on to public comment. I don't know if there are folks here. I don't know if you want to can you give instructions for what folks should do if they want to give public comment, Caitlin?
Yeah, so real quick, I'm going to bring up the timer so that if there are folks on the call who want to give public comment, we can use the timer. We don't have any in-person attendees, so if anybody online wishes to give public comment, please raise your hand. I'll give it a moment.
See everybody?
Yeah, I can see everybody. So we have
Okay.
5 attendees. So I'm not seeing any raised hands at this time. However, we will accept written public comment in the next 48 hours. Those comments should be sent to housing.taskforce@delaware.gov. Any comments that we do receive within that 48-hour time frame will be appended to the draft meeting minutes.
Caitlin, this is Sarah. I provided you with a letter from one of my clients that would like to have their letter included in the
For today.
recommendations.
Okay, yes. I'm glad
Recommend-
you reminded me because I know you sent us that email and I had it on my to-do list to ask if that was also for public comment, and it is. Okay.
So it's for public, sorry, just to clarify, it's for public comment?
Correct.
Okay.
All right. So,
For public
It is for public.
It is for.
Got it. Okay.
all right. So Caitlin, that is me. I will add the public comment received via email. All right. I will turn it back over to Rachel for any closing remarks.
Okay. Closing remarks. All right, so thank you all. I think my closing remarks would be many of us, not all of us, but many of us are hopefully taking some time off over the next week or two around holidays. And so don't do it then. But before our next meeting, you know, my plan is to, similar to what was done last time, take what we discussed, try to organize it in a way that makes sense. I really want to encourage folks to, before we come to our next meeting, read the new document that gets sent out in advance and come really thinking about like what the priorities should be. If based on what's already in the document and what we've discussed so far, you feel like we're really missing something, please let me know. So that when we meet next time, those things, we can be prepared to discuss them a little bit more in advance. Because I know our next meeting might be the last one, in which case we need to really have some approved, clear recommendations. So that would be my ask for committee members. Feel free to reach out anytime before then. And we'll get that poll out for availability. But thank you, everyone. I hope you have a restful, healthy, peaceful next couple of weeks.
Right. Thanks, everyone.